Hi, everyone. Thanks for joining us today. Mike and I are going to be talking today about concussion treatment. I have a couple questions for him. So, at Core Balance Therapy, Mike, we've been treating concussion since we've been in business. That's one of the main diagnoses that we've been treating for over 20 years. And over the last 5 years especially, it seems like there's been a pendulum swing in change of treatment or approach to post-concussive patients, especially when it comes to recommendations for rest. The term cognitive rest, I guess, specifically has come into play, whereas now the evidence is showing maybe not that, but that hasn't really soaked in to our healthcare system yet. So can you address how that changed? What were the recommendations? And now, given the recent evidence, how it might not be the recommendation?
Yeah. So the old school train of thought was that you needed to let your brain completely rest, and that included, staying away from all stimulus and things like that, and putting yourself in a dark room and avoiding bright lights and avoiding, work and school and things like that. And what we found is actually there needs to be a very short amount of rest. So anywhere from 24, 48 hours, sometimes 3 days, but rarely. And then after that, and sometimes even within that time frame, you actually want to start returning to your normal activity, and you even actually want to start doing sub-symptom thresholds, so movements and exercise like walking and things like that that do not trigger your symptoms, because there's a certain value to returning to your normal function in terms of blood flow and just general health and wellness. And so we want to stop recommending people sit in dark rooms, because then it's just like when you're in a dark building and you go out into the daylight, like you've been in a movie theater, and then you go outside and your eyes are just like slammed with all the bright light because it's sunny outside. Well, imagine you do that to yourself and you have you're still recovering from a concussion. Imagine how intense that would be on your nervous system. So you don't actually want to sit with sunglasses on all the time or sit in a dark room, because then your eyes start adapting to that darkness.
That's a great analogy. So besides not really resting so much as we thought a few years ago, what are some typical treatments that someone with post-concussive syndrome is going to encounter in their course of care following their diagnosis?
So normally right around the 10-day marker, if someone's still dealing with persistent symptoms, that's when we start to think about post-concussion-based treatments and things like that. And there's a few different systems that could be involved that we would generally address here. And the big three that we would look at are your vision, your inner ear or your vestibular system, and then your neck. And so we would actually start having you work on neck exercises early on, even in the acute phase, because oftentimes, if someone has had a concussion, they most likely have had some form of whiplash injury, because the amount of force that it takes to create a concussion is more than it takes to create a whiplash injury in your neck. So most people will have some sort of neck problem. And that is often overlooked by providers. They think it's mainly up here, but oftentimes the relationship between your neck and your brain and your inner ear is forgotten. And so we'll have people start working on their neck. And then once we get to about the 10-day marker, then we'll start doing more specific assessment to determine which is the most affected system. And it could be all three. It doesn't have to be your inner ear, your eyes, or your neck. It could be all of them working together. So then we start looking at if someone's got some muscular restriction or joint restriction in their neck, or the way their inner ear is communicating with their eyes, telling them where they are in space isn't working so well, or if it's just their eyes, the input from their surroundings isn't being received properly from their visual system. And so, and that can involve exercises, it can involve hands-on treatment, and a whole lot of education. Education and reassurance of everything. We know what we're doing, and we know that you can get better from this. That's actually where the most value has been shown, is really educating people on what's going on and how they'll get better, and reassuring them that they can get better.
Yeah, there's a lot of difference between how patients might present, and certainly it seems like the treatment for each patient might be a little bit different.
Yep, that's one of the biggest things, is it's not a one-size-fits-all kind of treatment plan. All the research papers for post-concussion syndrome really emphasize that the treatment plan needs to be individualized to each specific patient's presentation and each specific patient needs and things like that. So, a football player with a head injury may be different than someone who's been in a recent car accident that needs to get back to their computer job and things like that. So there's also, considering what stage of life they are in and what their end goals are always really important too.
Yeah. Great. All right. Well, that's all the time that we have today. Thanks for joining us. And I'll let you get back to treating patients today, Mike.
Thanks, Amy.